Hi, I'm Dr. Sedano, the Director of Clinical Support and Education at Avexia Diagnostics. Today, I want to talk to you about a test we offer that assesses for mercury exposure, and this test is called the Mercury Tri-Test. Now, what's special about this test is that it is an advanced mercury analysis test that identifies the different sources of mercury by measuring the relative amounts of the two forms of mercury in the body. It's methylmercury, also known as organic mercury, and inorganic mercury. And this test also assesses for mercury excretion capabilities of the body for those two forms of mercury. Now, as you most likely know, mercury exposure can come from contaminated shellfish and seafood, can come from contaminated water supply, dental amalgams, laboratory equipment, mining, and smelt factories, to name a few. The signs and symptoms of mercury toxicity are variable, and they can include a metal taste in the mouth, increased salivation, paresthesias, decreased hearing, touch, and vision, hypertension, headaches, fatigue, insomnia, fine muscle tremors, and emotional and cognitive disturbances, which are actually quite common. It's important to know that mercury toxicity can vary with the form of mercury, the dose, and the rate of exposure. And keep in mind that the target organ for inhaled mercury vapor, such as inorganic mercury amalgams, is primarily the brain, as opposed to methylmercury, which chiefly damages the gut lining, the kidneys, and is widely distributed throughout the body. Now, as I said earlier, the Mercury Tri-Test differentiates between those two different forms of mercury, and that's going to help you identify the source of exposure and evaluate the toxicity level more accurately. Now, this test utilizes whole blood, urine, and hair specimens. In regard to whole blood, now whole blood is a direct measurement of metal in the body. The urine is used to assess for the ability of the kidneys to excrete inorganic mercury, and the hair sample is used to assess the amount of organic mercury that passes through the liver. Now, it's important to know that hair mercury concentration appears to be proportional to blood methylmercury concentration, and therefore can be used as a surrogate for bile in the evaluation of methylmercury excretion in the liver. Now, assessing for mercury excretion by identifying the concentration of mercury in the blood and the concentration of the excretion products in the hair and urine, what that's going to do is provide you information about the excretion pathways and the need for support. Now, it's important to remember that if the excretion pathways are impaired, detoxification protocols often can make the patient's symptoms worse, so please keep that in mind. Another great advantage of this type of testing is that there is no need for chelation prior to testing. And you may recall that one of the risks of chelation is the potential redistribution of metals in the body. I hope this information serves you and your patients well. Until next time, I wish you all the best personally and in practice.